Now I want to turn it over to Jen Hutton. Jen is the CEO of Women's Crisis Services of Waterloo Region. In partnership with the community, Women's Crisis Services of Waterloo Region empowers and supports women and children to move beyond violence and abuse through the provision of safe shelter, education, and outreach services. Women's Crisis Services operates two emergency shelters and Selma House in Kitchener and Haven House in Cambridge. And that's just a tip of the iceberg of all the various things. But so, Jen, I'm going to throw it over to you now.
Yeah, thanks so much, Rob. So as Rob mentioned, I'm Jennifer Hutton, the CEO of Women's Crisis Services of Waterloo Region. Thank you so much to everyone who's joining us this evening. And as you can tell already, this is heavy stuff that we're talking about. So just make sure you take good care of yourselves, knowing that this content is heavy and can weigh heavy on folks. So just take good care of yourself. So first, I want to start with giving a bit of an overview of what Women's Crisis Services of Waterloo Region does, what we provide the community. So we have safe shelter, and we have that in a few different ways. We have Selma House in Kitchener and Haven House in Cambridge. And those shelters are 45 beds each. So we have 90 violence against women shelter beds in our region. We are, if not the largest, one of the largest in the province. And then our most recent housing addition is Aspen Place. And Aspen Place was something, a new property for us that we purchased a little bit over a year ago. And actually, we've been running it, I should say, now a year. And Aspen Place is a triplex for transitional housing. What we had found in shelter is, especially during the pandemic and the affordable housing crisis, is that families are staying in shelter for longer and longer periods of time. You know, when I started in this work 10 years ago, I would be telling you that our length of stay is, 6 weeks, 8 weeks before people are moving on to affordable housing. And now it's, 5 months, 6 months, and that's still pretty good. We've had families stay with us upwards of a year. So Aspen Place allows us to move families into supportive transitional housing to be that second stage. So they've had the stabilization of shelter, but they don't need it any longer, and they're ready to move on to semi-independent. So that Aspen Place is small, but it served at least I think 9 moms and 18 kids already. So that model seems to be working pretty well. And at any one time, about 50% of our residents are children in shelter. We also provide outreach services in our community. We see about 1,100 folks through that program. That's for women and gender diverse individuals. And with that service, people can reach out to us and get connected to an outreach worker. And they're seeing that outreach worker usually in a week or 2 weeks. It's quite quick turnaround. And the outreach worker can really meet that person where they're at. And I mean that figuratively and literally, if people want to meet in the community, if it's safe to meet in the home, if they want to come to the Family Violence Project, then all of that can happen. And it's quite a flexible and accessible program, which is really important for those that we serve. And the way to access our supports, whether it's shelter or outreach services, is to call our 24/7 support line. So the numbers are there. And we also, during the pandemic, we added an online chat feature that is available through our website. So our programs, we like to say that we're much more than shelter. We really try to have a wraparound service. In shelters, we have music therapy, we have child and youth programs, we have an addictions and mental health support worker. We run a number of groups, food and nutrition program, and we also have a lot of groups and stuff happening in the community. And some of that's much more of a prevention type nature, such as a youth education program, and working quite closely with partners such as Family and Children's Services, where we have a worker in our shelter and we have one of our staff in the Family and Children's Services building. So I just wanted to share a little video clip with you. Some of you may have heard about our She Is Your Neighbor project. That originally started as a podcast, and most recently we've added a short documentary. So I was just going to share a quick clip of that, and then you can find the full documentary, which is only 7 minutes. Available on YouTube. When there's awareness, then action can follow.
People don't understand that keeping the secret and not talking about it's harboring our perpetrators.
I really do think that we all have a role to play in ending domestic violence.
We need people to feel like, oh, this is something I want to be on board with. This is something I care about. This is something I'm proud to talk about supporting.
That's kind of the next step. We need to go into action. I wanted to give you just a little sense of what we've been doing through our She Is Your Neighbor project. And some of the people speaking here today has been guests on our podcast. And with that podcast is really around looking at the complexity and the many intersections of domestic violence, which is a little bit of what you're getting here today as well. And then, of course, with the short documentary, we did that with local company Digital Sabbath. And again, a really good tool to raise awareness. And it actually was shown, I believe, last week in New York at a film festival and won an award in the Hamilton Film Festival. So pretty cool way to raise awareness. But awareness is step one. And as I say in there, our next step is really around action and how we move this growing awareness, because I do believe that people are becoming more aware of the issue. But how do we move more to action? So why are we calling domestic violence an epidemic? Well, here's some numbers to tell you exactly why. 1 in 3 women worldwide have experienced physical or sexual violence, mostly by an intimate partner. Every 6 days, a woman in Canada is killed by an intimate partner. Yet we know that 70% of domestic violence is not reported. And there's a huge cost to this issue. And I think sometimes that gets forgotten. And when we talk about the importance of funding prevention and upstream, is because this is a costly issue. Like the ultimate cost, of course, is cost lives, which Christine alluded to, and I'll talk about a little bit more. But it's also huge costs on emergency services. It's huge costs on employers because there's lots of issues around lost time. So I think that's just something important to consider, is just this significant cost that is associated with this issue. And just again, noting that it comes in many forms. So kind of dovetailing back to the podcast, we had a specific series focused on femicide. And we're starting to hear that term used a little bit more often. Unfortunately, there was a femicide earlier this week in Windsor, and the media actually used the term femicide, which is again something new that seems to be coming. And this is really linked to gender. This is intentional killing of women and girls simply because they're women and girls. And oftentimes when a woman is killed, it is from a loved one. Whereas when men are killed, it's typically maybe an acquaintance, could be more likely a stranger, but women and girls are definitely more likely to be killed by those closest to them. So last year in Ontario, there were 52 femicide in 52 weeks. This year, there's already been 55 femicides in 48 weeks. There was 9 in Ontario in October. Of course, was included in that was the family from Sault Ste. Marie. So, and November, unfortunately, is not looking good either. OAITH, which is our Ontario Association of Interval and Transition Houses, does a monthly count and provides a bit of a snapshot. And again, that is just so that we have a sense of what's going on. This has really been a hidden issue. We would hear about women being killed, and you might hear a statement like, there's no concern for public safety. This is a huge concern for the public. This is a public issue. And it's often because it's was a femicide from a family member. These deaths are definitely predictable and preventable. And there's factors that that's important to be aware of, because as much as 70% are not reporting it, it's usually 80 to 85% of friends or family are aware of this, but yet they don't know what to do. So with that, I also encourage people that's worried about a loved one to reach out to our crisis line, because there is signs, there's red flags that people need to be aware of and look for. And then I'm just going to wrap it up with one tiny quick plug that this Saturday we're doing a walk, and I'm hoping to have lots of people come out wearing purple, the domestic violence color, and we're walking 6 kilometers because every 6 days a woman in Canada is killed by an intimate partner. So thank you so much.
Thanks, Jen, for that. And yeah, I was going to make sure that we mentioned the fundraiser that's coming up, because, you know, we can talk, but we need money to go to various social agencies and every place else to work on this issue. And that's why we're trying to get the Ontario government to acknowledge it as an epidemic, so that resources get put towards this issue. I just saw there was a comment in the chat from Charlotte Hendricks. So I think when you were talking about your residences, her question was, why are the stays longer?
Yeah, that's really attached to the affordable housing crisis. So that housing is just not turning over. There's not enough supply available. So people are having to wait longer. And previously we would have some residents that could afford market rent that may not be able to afford market rent any longer. So that means that they stay in shelter because they don't have anywhere else to go until something opens up.
And that's the great backup that's happening. The transitional housing is getting backed up, and it's hard to move people places because there's no place to move them to, and so hence the need for more spaces. On the femicide question that Charlotte has, maybe we'll get later when Staff Sergeant Hatchborn is speaking to talk briefly about that and murder charges.